Hello again, and welcome to my channel, where I discuss all things related to therapy and human psychology. Please remember my channel is for educational and entertainment purposes only, and it is not a substitute for therapy or formal clinical diagnosis. In this video, I will be discussing a theory I have formed based upon my own personal and professional observations. It is a controversial one these days, so buckle up and prepare to practice those emotional regulation skills. Today, I'm going to make the case for why gender dysphoria is in fact a form of body dysmorphia, and why it should be treated along the same clinical lines. Let's begin with what body dysmorphia is. Broadly speaking anyway, according to the latest edition of the DSM, body dysmorphic disorder, or BDD, requires that a person exhibit a strong preoccupation with a perceived defect of the body, which is slight and viewed as insignificant by others. Okay? There must also be behaviors or mental acts which result from this preoccupation, such as mirror checking, seeking reassurance constantly, frequent comparisons to others, or excessive grooming and maintenance of appearance. This, of course, must also include clinically significant distress, which results in materially evidenced interpersonal, occupational, or physiological dysfunction. Finally, it cannot be better explained by something like an eating disorder or another diagnosis. Now let us review the criteria for gender dysphoria, or GD. A person must experience what is called a marked incongruence between one's perceived gender identity or expression and one's primary or secondary sexual characteristics. This can include a strong desire to change or be rid of one's sex characteristics, to gain the sex characteristics of the opposite sex, or the idea that one's behaviors and thoughts are incongruent, not matching, with current sexual traits. Significant clinical distress must again be evidenced in the same ways mentioned before. A brief side note here, there is a class of conditions called disorders of sexual development, or DSD, at times referred to as intersex. Gender dysphoric individuals almost never have these conditions, and there is no relationship between them that is significant or meaningful. In this video, I am not referring to anyone with a DSD, as it is not a mental health diagnosis. Now let us examine the striking similarities between body dysmorphia and gender dysphoria. Both involve distress that stems from a fixation on the body. Both can result in similarly maladaptive cognitions and behaviors, like a persistent preoccupation with appearance or bodily change and transformation. Most notably, both stem from the idea that the body is in some sense wrong and must be changed in order to attain relief. Finally, the problems perceived by the affected person are not of obvious or apparent significance to others. The standard treatment for body dysmorphic disorder is a form of cognitive behavioral therapy, CBT. It initially focuses on psychoeducation, which highlights in clear terms that BDD is a disorder of distorted self-perception rather than actual physical defects. In other words, it is made clear to patients that their understanding of their physical body is incongruent with reality or reality's limits. In other words, how you feel about your body is not reflected in any kind of material reality. The goal is to reframe and challenge the negative and distorted thought process that maintains the maladaptive behaviors and cognitions. Eventually, exposure therapy is used to help patients achieve what is called disconfirmation, or proof through real-life interaction that their assumptions about themselves and how others see them are incorrect. Eventually, if all goes well, patients come to accept their bodies as they are, having achieved a more realistic, less distorted sense of self. Characterizing the distress of gender dysphoria as separate and distinct from body dysmorphia is not only logically indefensible in my view, but clinically unsound. This is because by ignoring the body image distortion element of gender dysphoria, the treatment protocol becomes the opposite of what it should be. Instead of increasing acceptance of self or reality's limits, such as it is in almost any other mental health treatment protocol, gender affirming care conflates mental and physical states as one and proceeds to recommend hormonal and irreversible surgical change, as though to suggest the way one feels is the way one actually is. To put this in perspective, imagine a man feels he is too short and is so fixated on this feature that he desires leg-breaking surgeries to make himself taller. Or a woman feels she needs larger breasts because otherwise she is convinced she will never marry well. I do not know any therapist who would recommend a surgical solution to these people. To do so would be to affirm a problem that does not need to exist. Yet this is exactly what so-called gender-affirming care does. Unnecessarily affirms a distorted self-evaluation. To be absolutely clear, I am in no way denying that the distress of gender dysphoria is real, or that gender dysphoria itself, the sense that one's perceived gender identity is incongruent with one's body, exists. To my mind, there's actually nothing wrong with a man choosing to present like a woman, and there's nothing wrong with a woman presenting like a man. Anything a man does is something men can do, and anything a woman does is something women can do. What I am commenting on is the idea that the way one thinks or the way one feels determines what one actually is. Merely feeling like a woman does not make you one biologically, and feeling great distress about one's body does not mean there's anything actually wrong with your body. Mental states can, and often are, detached from the reality of our bodies and circumstances. People can feel and perceive all sorts of things. That does not make them true. Gender dysphoria is the only mental health condition in which a personal perception and not reality guides treatment. As a result, patients are encouraged to pursue impossible goals that both necessitate surgery and increase dissatisfaction with their natural body. It is my view that people experiencing gender dysphoria can benefit from the same treatment methods as those with body dysmorphia. Such methods encourage and assist patients in self-acceptance and learning to adaptively cope with the limits of reality. Thank you for listening. Be sure to like and subscribe, and please check out my other videos. Goodbye.